11 minutes. That's not a lot of time. Barely enough for me to run from my math class to chemistry. Now think about this. Every 11 minutes, one North American dies from an opioid overdose. The opioid crisis has transformed the face of addiction, making healthcare providers question everything, from the way pain is managed to the underlying causes of disease. Hello, all. Today, my team, consisting of Adam Jeremick, Saad Sheikh, Maya Andrews, and myself, Priya Sethi, are honored to discuss the public health epidemic of opioid misuse and addiction.
So opioids are a class of drugs that are powerful analgesics or painkillers. Many different opioid drugs exist that can be prescribed by physicians to help alleviate chronic or persistent pain in patients, some of which include the drugs codeine, oxycodone, hydrocodone, or morphine. However, certain illicit opioids, such as heroin or fentanyl, are highly addictive and can be taken recreationally to induce feelings of euphoria, leading to their misuse. All opioid drugs are chemically related to a class of substances in the body known as endogenous opioids, which can modulate our body's reaction to painful stimuli and can also regulate bodily functions such as mood control. Due to their structural similarity, opiates such as heroin or morphine interact with pre-existing opioid receptor sites present on nerve cells in the brain to provide feelings of pleasure and pain relief for the user. While opioid pain relievers are generally safe when prescribed by a doctor and taken for a short time period, the pleasurable feelings of the drugs can lead to their misuse. The powerful pleasurable reaction can cause users to continuously return to the abuse of the substance as they seek out those same euphoric feelings. The longer this abuse occurs, the more susceptible they are to become dependent on the substance, and their tolerance to the drug's effects begins to increase. Once they become addicted, users will try to seek the drug out at all costs, causing serious harm to themselves or their loved ones. Ultimately, the abuse of opioids can lead to overdose accidents and even death in these individuals.
The immediate risk of intaking opioids is addiction. To quote Chief of Primary Pain Management Dr. Stephen Mudra, anyone who takes a prescription opioid can become addicted. This addiction or misuse can lead to many physical, psychological, behavioral, and even social symptoms. Opioid misuse and addiction may not always be easy to detect, and we encourage those who suspect that their loved ones may be misusing opioids to observe the physical and behavioral symptoms closely. Observable symptoms include poor coordination, constricted pupils, drowsiness, mood swings, low energy, and low sex drive due to decreased testosterone in males or decreased estrogen and progesterone levels in females. Common symptoms of long-term misuse include gastrointestinal problems, fatigue and depression which affect functionality, sleep apnea and impaired breathing while sleeping. This may contribute to poor thinking ability, which increases risk for many health conditions and accidents, and a high risk of developing opioid-induced hyperalgesia, which is a state of feeling increased pain from a stimulus that normally provokes pain, but not to the extent of what is felt by the user. This contrasts the purpose of taking prescription opioids in the first place. As a result of the physical, psychological, and behavioral symptoms, negative social consequences are proposed in the lives of addicts. These include spending time in isolation and avoiding loved ones, losing interest in activities and self care as addicts become consumed by the obsession of intaking more opioids. Because of their disorientation and impaired judgment, they may fail to fulfill responsibilities or even get in trouble with the law. This can further result in financial hardships. Hence, it is important to consider that the consequences of opioid misuse and addiction stretch far beyond physical effects and can completely misshape the lives of individuals.
The opioid epidemic is the result of a complex and dynamic interplay between environmental and individual causes. We can dissect these causes through the host agent vector environment model. This model analyzes the host, which is the opioid user, the agent, which is the type of opioid, the vector, which is the means by which the opioid spreads, and finally, the physical and social environment. Starting with the host, opioid users are subject to vulnerability via their genes and socioeconomic factors. Twin studies within literature strongly suggest that risk for substance use disorders can be inherited and thus increase the likelihood of opioid misuse. Furthermore, the impact of socioeconomic factors are not to be neglected. Current trends show prescription opioid misuse rates increase similarly with poverty and unemployment rates. As for the agent, different types of opioids can lead to more mild or drastic impact. Here's an example. Approximately 80% of individuals who first use heroin later misuse prescription opioids. As a result of switching between two different types of opioids, these individuals experience a shift in severity of adverse health impact. This switch can be the cause of misuse due to the diverse and erratic nature of the chemical properties types of opioids. The two vectors involved in the spread of opioid misuse are through medical prescription and illegal drug trade. Opioid prescription is particularly important because it can and should be regulated through our healthcare system. In fact, the healthcare system is where the initial widespread of opioid misuse all began. This occurred in the 1990s when pharmaceutical companies incorrectly informed healthcare workers that patients would not become addicted to opioids. Lastly, rates of opioids can vary significantly among physical and in social environments. This variation can be attributed to healthcare infrastructure, availability of treatment, and prevalence of drug traffickers. We should also consider the social environment of the host. Having a support network that is fundamental to the role of an individual's addiction and as well their recovery. Without this support, it can be easier to turn to opioids as a way to cope. These causes can be multifaceted and deeply rooted in the numerous areas of influence. So rather than isolating the cause of opioid misuse as simply one factor, we must dig deeper and consider how all factors have a unique contribution to causing this epidemic. Such complex causes can be the issues that require solutions that are equally or perhaps even more complex.
60% of adults with PTSD and childhood trauma have developed substance abuse problems, especially opioids. At the end of the day, opioid abuse realistically cannot be completely abolished. Majority of people do not abuse this drug because they want to, it's because they need to, as they have nowhere else to turn to while coping with their traumatic life experiences. So what we can do at least is control this epidemic and try to stop the overdoses and deaths. Now, searching solutions online for this extremely complex problem can only do so much. This is why some members of the Western Public Health Team went down to the regional HIV/AIDS connection in London, Ontario to learn firsthand about the crisis and what a sustainable solution can be, and this is what we derived. First, before we can start to help those affected by the crisis, we need to educate Canadians on this problem. There is a stigma concerning opioid abusers and how they may be of a certain socioeconomic class and act in certain behaviors, and this stigma is what's stopping Canadians from helping those who need help. In reality, opioid abuse can happen to anybody. The manager we had met at the safe injection site told us he's had people come with PhDs and loving families. Some would even sing so beautifully or do magic tricks. Those abusing this drug are people like you and me that are well educated and have many talents, and the rest of Canada needs to realize this. Second, we need to regulate and become more strict with the initial prescriptions given. More than 191 million opiate prescriptions were dispensed to American patients in 2017. This is a huge number, and it is a number that's actually growing each year. Although doctors have recently been more strict on prescribing opiates to a patient for an extended amount of time, the amount of initial prescriptions is staggering. And if a patient starts to abuse opioids with the initial prescription and the doctor won't give them more, they turn to illegal opioids, and that can be laced and contaminated, or to harder drugs such as heroin and cocaine. Third, as I said earlier, we need to support those affected. One way we can do this is through the introduction of safe injection sites. There is a huge misunderstanding on safe injection sites, but it can be a tool and already is a tool in many parts of the country that can decrease the rates of opioid abuse in overseas. Safe injection sites allow citizens to come in and consume their opioids in a relatively safe environment. Safe injection sites have doctors and nurses on standby for the person if they need it. And if the person does happen to overdose, they actually have a drug called naloxone that can reverse an overdose. The safe injection site we visited claimed that about 50 people overdose each day in their safe injection rooms, all of which they had tended to. Imagine how many lives may have been saved because people overdose in that room instead of the streets. If we can derive a solution based on these three principles, we can have a more safer and positive outcome to this crisis.
So, going back to the number 11, in 2017 alone, approximately 11 lives were lost every day in Canada because of opioid overdoses. This issue has become a public health crisis with such devastating consequences. But by making the right strides in a collaborative effort with our community, we can help to lessen the impact of this epidemic and improve the lives of all those affected. Thank you for listening to our presentation.